The hospital radio report is an important piece of the continuum of care and can directly reflect on the perceived ability of the EMS provider. A great radio report is clear, concise, and includes all pertinent information. The intent of the hospital radio report is to give the receiving hospital a brief 30-second heads-up on a patient who is on the way to their emergency department. While the pre-hospital radio report should be brief, it should also paint a broad view of the patient's overall condition to help the ED staff identify critical or unusual patients that will require intensive or special resources. Radio reports should be about 30 seconds and give enough patient information for the hospital to determine the appropriate room, equipment, and staffing needs. A good report has these crucial details. Units identification and level of service, ALS or BLS. Patient's age and gender. Estimated time of arrival, ETA. Chief complaint and history of present illness. Pertinent scene assessment findings and mechanism of injury, for instance, fall or motor vehicle accident. Pertinent past medical history, major past illness. Patient's mental status. Pertinent findings of the physical exam. Treatment and vital signs, baseline. Patient's response to treatment. When giving a radio report, don't include extraneous details, like speculations on how the injury occurred, or your personal opinions about the patient's condition. Hospital radio reporting is a skill that should be practiced by new EMTs and critiqued as a component of continuing education and recertification. When done correctly, the pre-hospital patient report can be an effective tool for conveying relevant information to the receiving facility so that the best possible care can be delivered to the arriving patient.